Every day, EMS providers must deal with potential exposure to disease-causing pathogens through contact with patient blood and other bodily fluids. For your protection, you must assume that all of your patients are potential carriers of infectious disease and take appropriate precautions to prevent exposure to their fluids. When you have an occupational exposure to potentially infectious materials, OSHA prescribes steps that you and your employing EMS agency need to follow to minimize the exposure and protect you if you are exposed. OSHA requires your EMS agency to have an exposure control plan that is designed to eliminate or minimize your exposures. The plan must include universal precautions to be followed and ensure that you will be provided appropriate personal protective equipment. For example, gloves to be worn when you can reasonably anticipate that you will have contact with blood or other potentially infectious materials. To maintain their effectiveness, the EMS agency is also required to clean and launder the equipment and to dispose of it and replace it when no longer effective. OSHA also requires the EMS agency to make available to you the Hepatitis B vaccination series, and if you have an exposure incident, post-exposure evaluation and follow-up, including prophylaxis according to recommendations of the United States Public Health Service current at the time. OSHA requires that all of this be done at no cost to you. If there is an exposure incident, it is important for you to immediately report this to the EMS agency. When you report an exposure incident right away, the report permits the EMS agency to arrange for your immediate medical evaluation. Early reporting is crucial for beginning immediate intervention to address your possible infection and can also help you to avoid spreading blood-borne infectious diseases to others. The EMS agency is required to perform a timely evaluation of the circumstances surrounding the exposure incident to find ways of preventing such a situation from occurring again. Reporting is also important because part of the follow-up includes identifying the source individual and determining the source individual's HPV and HIV infectious status, unless the EMS agency establishes that identifying the source individual is infeasible or prohibited by state or local law. If the status of the source individual is not already known, the EMS agency is required to get the source's blood tested as soon as feasible, provided the source individual consents. If the individual does not consent, the EMS agency must establish that legally required consent cannot be obtained. If state or local law allows testing without the source individual's consent, the EMS agency must have the individual's blood tested if it is available. The EMS agency must then make the results of these tests available to you and must also inform you of the laws and regulations about disclosing the source's identity and infectious status. OSHA imposes these requirements and others to protect you from exposure and when you are exposed. Do yourself a favor and learn your full rights and your EMS agency's responsibilities under OSHA. Thanks for watching.